Are you considering LASIK surgery? In this episode of OCuTALK, Dr. Cherie Fathy will be discussing pre-surgical consultations and what you need to know going in, what to expect after surgery, and how dry eye plays a factor. Dr. Fathy?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Cherie Fathy. Dr. Fathy, thank you so much for joining us today.
Thank you. Thanks for having me. I'm excited to be here.
Well, we're excited to have you here, Dr. Fathy. Thank you so much for joining us today. Before we get into our questions and our conversation, I was kind of hoping maybe you can introduce yourself to our audience, maybe let them know a little bit about your background and your specialty.
Absolutely. I'm happy to. So my name is Dr. Cherie Fathy. I grew up in Knoxville, Tennessee, and then made my way over to Vanderbilt University for college and undergrad. And then since then, I've migrated up north. I was at the Wills Eye Hospital for residency, and then just finished up my cornea fellowship at the Wilmer Eye Institute at Hopkins. And I'm now an attending at the Eye Doctors of Washington in the DC area.
Well, perfect. Thank you so much for that introduction. And so, Doctor, before we get going, we wanted to actually discuss today a little bit about dry eye and LASIK and how they're related. So before we actually get into our whole conversation, do you mind letting our viewers know a little bit about LASIK and what that is?
Absolutely. So great question. So LASIK is a procedure where we use a cutting laser to actually reshape the front of your eye, which is called the cornea. And we do that to improve your vision. It's a procedure that's been around for quite some time, but our technology only continues to improve. And so we've been able to deliver better outcomes and a safer procedure for patients.
Oh, awesome. Thank you for that information. And so now that we know a little bit more about LASIK, what makes a good candidate for LASIK surgery?
So generally, we're looking for people who are 21 years of age or older. We want to make sure that your glasses prescription has been stable for at least a year. And we want to make sure that you have a good general health of your eye. And it's also helpful if you're generally healthy overall, which most LASIK patients are. It's also really important to make sure that our patients are not nursing or pregnant at the time of LASIK surgery or at the time of their evaluation. And the reason for that is being in either state can actually temporarily change your refraction or your glasses prescription. And so again, we want to make sure that you're stable, so either not pregnant or being done with breastfeeding before we were to do a procedure like LASIK.
Well, excellent. Thank you for that information. And so now that we know what makes a candidate good for LASIK, on that opposite end, what actually would kind of disqualify a patient from LASIK?
Yeah, there are a lot of things that we closely look for when we evaluate patients for LASIK. Probably the biggest or most common disqualifying factors is a patient being too young or their glasses prescription not yet being stable. And again, the reason why that is so important is when we do LASIK, we want to do it for a time that'll just last you for quite some time. And if we do LASIK too early, just like you continue to grow up, your eyeballs are going to continue to grow. And so we could be treating you at a point in time where it's too early, and we'll do LASIK and it'll work for you for a little bit. But then as your eyeball grows, your prescription's going to change and it's going to feel like your LASIK wore off. So that's why we look for that refractive or stability in your glasses. The other thing that's really important for me is to make sure that patients don't have significant dry eye disease that we can't get under control, because that's going to impact, how much you like your LASIK afterwards and also how comfortable you are after the procedure.
Well, excellent information there. And so you talked a little bit about, some of the things that you look out for, like someone being too young and things like that. So during your pre-surgical visits with some of your patients, what other concerning things are you looking out for?
Yeah, so this is one of the most important parts of your LASIK procedure, and you want to make sure that you're with a surgeon or a provider who can do this very comfortably. My pre-op consultations are really making sure that your corneas are healthy enough to undergo LASIK. They're thick enough, they look healthy enough. I'm looking at your corneas and making sure you don't have corneal scars or ulcers that we would need to address, or maybe signs of chronic contact lens wear that may make it less safe for you to be under the laser. It's really important for me when I'm looking under the slit lamp, under the microscope, that they do have healthy eyes and they don't have significant dry eye disease, looking at their eyelid health for blepharitis, things that we can address before it ever becomes a problem is really important for me.
Excellent information there. And so, Doctor, you touched on it a little bit earlier when we were talking about, what patients usually do beforehand. And I wanted to ask you, how important are cleaning your eyelids pre and post surgery for LASIK?
That's super important to me. So I'm looking at the eyelids at every preoperative consultation. If a patient has signs of blepharitis, that's a buildup of debris at the base of your lashes. It's an incredibly common condition, but it's really important that it's a condition that we get under control before LASIK eye surgery. The reason for that is that blepharitis can increase your chance of inflammation after surgery, which just makes it a little bit harder for you to heal. Or very, very rarely, it can increase your risk for an infection. So if I see signs of blepharitis, I am asking my patients to start lid scrubs, to start treatments to help get that eyelid disease under control.
Well, thank you for that information, Doctor. And is it possible for someone who had LASIK done, would it be able for them to get dry eye afterwards?
Yeah, so certainly in the period after LASIK, as you're healing, it's very common to have the sensation of dryness or even have clinical signs of dry eye disease on examination. Usually the biggest risk factor for dry eye disease after LASIK is having dry eye disease before, but I think all of my patients probably go through a period where they feel like their eyes are drier than they were before LASIK. For most people, it's a transient thing. As you continue to heal, the further you are out from LASIK, you're more likely to return to what your state of dryness was before LASIK. But it's certainly possible, and for that reason, we're always encouraging patients to be on top of their artificial tears.
Excellent. And I know you probably talked about it before, but why do some patients develop dry eye after LASIK?
So it's for a myriad of reasons. Our hypothesis is that when we're creating that LASIK flap, there may be some alteration to the nerves on the corneal surface, and that may predispose these patients to dryness because they're just not getting the sensation that they used to get or that their eye used to get to allow them to create tears at the same level they were before. The other thing is they may be right after LASIK and trying to use their screens as much as they were before LASIK. And certainly you will get to a point where you can be on your computer all day like you were before, but right while you're healing, it's so important to be using the artificial tears, limiting your screen time, just giving your eyes a chance to heal.
Well, excellent. And again, you've probably touched on it before, but I wanted to ask, so we talked a lot about people who probably are on their phones a lot, and after LASIK it's probably not good, but who's more likely to develop dry eye after LASIK?
So my number one thing that I tell patients is if you had dry eye problems before LASIK, it is highly likely that you're going to have dry eye problems after LASIK. So we really need to make sure we get that under control before we even undergo the procedure. But other things that could increase your risks, being a little bit older at the time that you undergo LASIK. Sometimes being a female can predispose you to dry eye disease. And having a history of something called meibomian gland disease, where your glands are just not secreting oil as well as they should to keep tears on your surface, and so they evaporate quickly. Those are things that would increase the likelihood of having dry eye problems after LASIK. And just like you said, Nick, if you were spending a lot of time on your screens, you were drying out your corneas.
I do a lot of that, I guess, so it does dry them out a little bit. Thank you for that, Doctor. And what symptoms should patients be looking out for after they go through the LASIK surgery when it comes to indicate that they have dry eyes?
Yeah, so probably the most common thing I hear is like a foreign body sensation, feeling like something's in your eyes, or a gritty sensation. Ironically, patients will also tear when they're dry, and I'll have a lot of patients who come in and say, like, "Doc, I'm not dry. I'm tearing all the time," and that is actually a reflex tearing. So it's not the baseline tears that they should be producing. It's your eye kind of just sending an SOS saying, "Hey, we're really dry. We're just trying to get the eyeballs wet however we can." And it actually can affect your vision as well. So if you feel like between blinks or after artificial tear application, your vision improves, you probably do have some element of dry eye disease.
Well, fantastic. Is there anything that patients can do beforehand to kind of prevent this kind of from happening?
Yeah, it's a great question. So as soon as I've signed a patient up for LASIK, I'm asking them to, on their way home, before they get home, to just go buy a huge box of artificial tears, preservative-free artificial tears, and just start from the pre-op stage, from as soon as you're signed up. One, it'll just help build that muscle memory after surgery as well. But two, the better lubricated your eyes are at the time of the procedure, I really do think the better that you'll heal after surgery. So that's probably the best thing that patients can do on their own. There's not just artificial tears, there are ointments that they can apply. If your provider or surgeon talks to you about meibomian gland disease, then talking about warm compresses, lid scrubs, those will all be things that you could do to help decrease your chance of dry eye disease being a significant burden for you after LASIK.
Oh, well, perfect. And we talked about beforehand, you talked about going to buy some artificial tears, some nighttime ointments. What is the dry eye care treatment for after LASIK, or your recommended dry eye care, I should say?
Yeah. So on your way home from LASIK, we actually encourage you to use the preservative-free artificial tears as much as possible, even up to every 10 minutes in that first day after surgery. And then we spread it out a little bit after that. But again, being very regimented about the artificial tears is very important. The other things are things that we can do in clinic or prescribe for you. So we can sometimes place a device called punctal plugs. These actually plug up where the tears drain and allow the tears to stay on your surface, so that there's more lubrication at baseline with these plugs in. We can also prescribe dry eye medication for you to improve the quality of your tears. And then for much more severe dry eye, we can talk about things like bandage contact lenses to help with your healing, or something even called amniotic membrane transplants or treatments that allow for regeneration of the nutrients that should be on the eye. And then, of course, if we're seeing continued signs of meibomian gland disease or blepharitis, talking about incorporating lid scrubs that have hypochlorous acid or tea tree oil is very helpful.
Well, excellent information there. And are there any new technologies or developments that we should be on the lookout for when it comes to LASIK?
Yeah, I think there are two things that I'm very excited about. They're not necessarily new, but I think the adoption in the ophthalmology community is getting bigger and bigger, and that's only better for patients. So the first thing is using something called topography guided LASIK. So that is where we actually take a picture of your cornea, and then we individualize the treatment of the LASIK exactly based off of your cornea. So instead of just doing a uniform, what's called ablation pattern or uniform treatment pattern, we're actually applying a treatment to every hill and valley that is on your cornea to provide a more precise treatment. I think this is a great option and something that patients should ask their surgeons if they have available for them or if they qualify for this treatment. I think it's just the top of the line of what we can do right now. The other thing is, if you are not a candidate for LASIK or PRK, then there is something called an implantable Collamer lens. Again, this has been around for a while, but a newer version of it has come out now. And I think it's great because it offers patients who, one, weren't candidates for refractive surgery an option to still get treated. And the other thing is, if you're a person who just says, I just don't really want to change the shape of my cornea, I don't want to have to deal with the dry eyes or deal with any of the, potential things that can happen after refractive surgery, you can still get this treatment. We actually do it for low-level treatments as well. And the nice thing is, if you don't like it, we can take it out. You've probably seen the commercials that have Joe Jonas in them now. That's actually one of his things. He just got the ICLs and he will say, if I don't like it, I'm just going to take it out. So it provides this nice, almost reversible option for patients.
Well, excellent information there, Dr. Fathy. Thank you so much. And before we leave today, was there anything else that you'd like to let our audience know about?
Yeah, I think my biggest word of advice, if you're thinking about LASIK, beyond making sure that you go pick up your bottle of artificial tears or your bottles of artificial tears on the way home, would just be to make sure that you feel comfortable with your surgeon and the practice where you're planning on getting LASIK. Where you feel like you can reach out to the surgeon if there are any issues or their doctors who work with them. I think it's really important to just feel like you are attended to, that your questions were answered, that you feel like you're in good hands before you proceed with LASIK. That's something that's really important to me in providing for patients.
Well, awesome. Thank you so much, Dr. Fathy. Everyone, that was Dr. Cherie Fathy. Thank you so much for joining us today.
Thank you so much for having me. I really appreciate it.